स्टैंड नहीं लाया ना, स्टैंड नहीं लाया, प्रोजेक्टर बंद। तेरे पास ट्राइपॉड भी नहीं है ना? ट्राइपॉड भी नहीं है ना तेरे पास?
Hello, good afternoon, everybody. All on the behalf of growing, develop bonding with the mother, less learning disorder or behavior, and these children they have a better cognitive function. So they have those who are exclusively breastfed for 6 months, and after 6 week breastfeed 2 years of age, these children have the maximum benefit of this development of a brain. So we, at least I last 31 years, I am not a single patient I have prescribed bottle feeding or top feeding. Unless they themselves do, and I try to discourage. But first 6 months only breastfeed and only breastfeed. No balakadu, no janamguti, no honey or whatever there is, only breastfeeding. So I have introduced my team, and I have a small video. Can you play, please? This is a center. Thank you. Now I have started this child development center. The reason behind last 15-20 years, these cases of developmental and behavioral problems in children are increased. And after COVID, this has increased exponentially. The reason during COVID, during the lockdown period, the schools were closed. There was less social contact and communication, interaction with other kids. This is very crucial for behavior and development of a child. There were increased stress in the parents because of lockdown. They were not working. They have lost their job or they were not paid. So they were stressful, and that stress has passed on to the kids. So kids were stressful, and those children were having the problem. They were not able to get those services of various development center. Because of lockdown, children were more exposed to mobile. Previously used to avoid children the mobile, but during lockdown, that was the only way to communicate to the school or the tuition classes. So they were online classes of the school. So kids were glued, they were attached to mobile most of the time. There were increased exposure to the TV and social media exposure. And recently, maybe after COVID or last 5-7 years, there is increased awareness among the children, among the parents about all these developmental and behavioral problems. And there is also awareness among the school teacher also, because they see these cases. Out of these 40 kids, this one or two kids, they are different. So they normally they inform to the principal, and then principal call the parents and they tell, okay, this child has got some problem. You see to the either child specialist, or you see the developmental pediatrician, and then the problem detected and then it's managed. Actually, approximately in India, this autism spectrum disorder incidence is quite high, 1 to 2%. This is in India. In Mumbai and Maharashtra, I think it will be more, but there is no data available. ADHD incidence is about 5 to 10%, and learning disabilities incidence is about 5 to 10%. And now you must see all these young kids and teenagers, and they have a lot of behavioral problem, like they are very aggressive, they are very arrogant, they are very defiant, they are very stubborn. So they don't listen. So this problem is increasing day by day. Another problem which is rampant in is that it's a substance abuse. Substance abuse, most of the people in the Vikroli group may have seen, there is one video I think somebody circulated in our group. They have shown that there is one place where the drugs are easily available. Another, I will give one personal example. Before my hospital got redeveloped, you must have know my hospital was in that church, and next room was it was closed and abandoned. And in that abandoned room, every day after 7:30, once the dark is there, at least 10-12 kids used to come and used to have a drugs. And that was knowingly, because next to it was my hospital. So many times we try to shoot them away, ask them to go away. 2-3 times I had done a police complaint also, but I got some my patients who are a police officer. They said कि सर हम लोग कुछ नहीं कर सकते, हम लोग इनको पकड़ते लेके जाते इसमें पुलिस स्टेशन लेके जाते हैं, बट हम लोग केस नहीं करते, क्योंकि क्या अभी ये बच्चे अगर अभी हम लोग इनकी केस करेंगे तो इनका हमेशा एक पुलिस रिकॉर्ड रहता है. ये बच्चे जब बाद में पासपोर्ट लेने जाएंगे, कुछ पोस्ट ग्रेजुएशन फॉरेन वीजा चले जाएंगे, तो इनका अगर पूछेगा पुलिस रिकॉर्ड पूछते हैं, पुलिस वेरिफिकेशन रहता है. अगर उनका पुलिस है तो उनका ये बर्बाद हो जाएगा. हम लोग नहीं करते, हम लोग उनके पेरेंट्स को बुलाते हैं और उनको बता देते कि आप उसका ये करो. एंड अनफॉर्चुनेटली इसमें मेरे रिसेप्शन से यहाँ पे है, मेरे जो 2 बच्चे थे, मतलब मेरे पेशेंट 2 बच्चे थे, वो मैंने एक बार देखा कि वो 2 बच्चे उसमें आते हैं करके. तो आई फील वेरी बैड कि मेरे जो बच्चे थे, ये एक जमाने में मेरे पेशेंट थे, अभी वो ये करते. तो आई फील वेरी बैड. सो आई थॉट कि मैं कुछ तो करना चाहिए मुझे. अनदर थिंग about to say this yesterday's day before yesterday newspaper, average age of these children they try substance abuse or drugs is 13 years. तो 13 years मतलब 8वीं 9वीं बच्चे और 11वीं 12वीं बच्चे, ये बच्चे ज़्यादा ये लेते हैं. तो फिर इधर मोस्ट कॉमन इज इनहेलेशन, मतलब जो स्मोकिंग थ्रू जाता है. सेकंड थिंग, आजकल जो मैंड्रेड एंड अदर टैबलेट्स मिलते हैं. ड्रग्स में जो आईवी ड्रग्स वगैरह वो बाद में, बिकॉज काफ़ी महंगा रहता है. तो ये अपना विक्रोल में बहुत रैम्पेंट है. तो आई थिंक आपके आजू बाजू में भी पेशेंट्स आप देखते होंगे, तो ये बहुत रैम्पेंट. इसको कोई पैसा ट्रीटमेंट, ये दवा नहीं है कि आप दवाई देंगे उनको. फर्स्ट ऑफ ऑल साइकियाट्रिस्ट हैज टू इवैल्यूएट एंड देन यू हैव टू डू द काउंसलिंग. दैट इज ओनली आंसर. So another thing, I have seen some of my patients here, they are taking here therapy with some centers, but unfortunately there are 1 or 2 centers which is managed by 1 or 2 person, which they are not a qualified people. So last few of my patients I seen last 3 years, 4 years, they are doing the therapy with that, but hardly any difference. So I thought, why not we start a center where we get all qualified people and start a center. But one of my close pediatric friend he told कि डॉक्टर तांबे, इसमें तुमको कुछ पैसा मिलने वाला नहीं है, ये हेडेक जॉब है और आप अननेसेसरी आपका स्पेस वेस्ट कर रहे हैं, इसमें कुछ ज़्यादा ये नहीं है. तो ऐसे कि मेरे को विक्रोली ने बहुत दिया है इतने साल में, तो इट्स माई टाइम टू गिव बैक टू विक्रोली. So it's not that I'm going to social worker or free treatment, but what I said I will try to give them a ethical treatment, and I will give them a qualified people who can treat them, so that after 6 months or 1 year I should get some result. और वो ड्रग एडिक्ट जो मेरे बच्चे मतलब जो पेशेंट्स है उनमें से अगर 2-4 बच्चे भी बाहर आ गए तो आई विल बी वेरी हैप्पी. थैंक यू. I will just ask Dr. Mehri Madam to start the session.
Is very important. मेरी आवाज is very important. मेरी आवाज आ रही है ना पीछे में? So early intervention is important because most of the brain growth it happens 5 years of life and more so in the first years of life. Hence early detection and providing is very important. And what are the things that we can look for? We will just quickly look at what are the different things that come up. जनरली जब बच्चे फर्स्ट ईयर में आते हैं इन द फर्स्ट 1 or 2 years इनिशियली मोटर डिलेज के साथ आते हैं जैसे कि वॉकिंग इज डिलेड, हेड कंट्रोल इज डिलेड, सो मोर ऑफ द फिजिकल साइंस. up to 1 to 3 years में you may see more parents coming with concerns around language delay. And also why this is important कि वो एज में हम उनको intervention दें क्योंकि the spurt of language growth happens in that age group. And you will see many children may be, for whatever reason, exposed to a screen that itself can delay language development. And if the child is on the spectrum, unke chances of receiving language development become even less. So it is important कि first 2-3 years में the language growth is happening. तो जैसे बच्चों का development होता है, उस हिसाब से जब हम उनको support देते हैं, so there is more better improvement, better stimulation. And whatever we train, wherever our energy, attention goes, energy goes. So as you can see, the language is most in between 0 to 12 and in the first 1 to 2 years. उसके बाद your higher cognitive functions they take over, and hence it is important that we take care of the early development. So motor delay would mean delay in achieving age-appropriate milestones. Typically we ask for walking, कभी किया, बैठा कभी, smile कभी किया. But when a child is referred to us, we are also looking at it more detail. When did he start sitting? There are some reflexes जो चले जाते हैं by 1 year, but if they are persisting, then there are chances of spasticity. So some of the things are like it could be gross motor delay, fine motor delay. A persistence of a delay, persistent asymmetry in movements. If a child has a hand preference before 1 year, and then if there is delay in sitting, walking, or if the tone is different. Of course, there is need for a proper birth history, a proper early milestones development history, feeding history to be taken. Usse signs, we get clues on what is the chances of some developmental challenges that might be there, and family history. So there might be traits in the earlier generations, which is also very important to record, especially when it comes for autism. Now, while delay in language is what a lot of parents will come with, but language delay के पहले भी काफी सारी चीजें हो सकती है which may be present. For example, response to name, eye contact and response to name. It is reduced or it is not there by 1 year of age. What this means is typically a child when you call they will look back, and most parents will say जब भी वो अपने पसंद का कुछ करता है तभी नहीं देखता है, अपने इंटरेस्ट पे करता है. So there is very inconsistent response to name. The other is just like we have milestones for motor skills, ग्रॉस मोटर के माइलस्टोन्स होते हैं, लैंग्वेज के माइलस्टोन्स होते हैं, उसी तरह प्ले के भी माइलस्टोन्स होते हैं. जैसे कि व्हाट इज द काइंड ऑफ प्ले दे डू. प्रिटेंड प्ले जो होता है वो 1 साल के बाद से शुरू होता है. तो चाइल्ड इज नॉट डूइंग प्रिटेंड प्ले. पैरेलल प्ले मतलब दूसरे बच्चों के साथ बैठ के साइड बाय साइड खेलना. दैट इज सीन बाय 2 years. 3 years में थोड़ा कोऑपरेटिव होना शुरू करते हैं. सो दीज आर आल्सो माइलस्टोन्स व्हिच नीड टू बी लुक्ड एट. So as developmental pediatricians, we take a history We observe the children in the clinic to see how they are doing these things. No meaningful words by 18 months. Typically, their first clear word, which is usually addressing a family member, it comes by 1 year. And it is used in a very meaningful way. And by 18 months, there is usually at least 10 to 15 words may have come. So parents may say things like कि वो रेडियो मतलब टीवी देख के पोइट्री बोलता है या उसके साथ गाना गाता है बट मम्मा पापा नहीं बोलता है. So what the child is really picking up is rote language, which he is learning, but it is not a meaningful language. And what autism basically is, it is a challenge with communication. So communication can be verbal, non-verbal. So non-verbal is they don't have proper eye contact, gestures may not be there, and it might be everything might be rote. And when we see one child with autism, we know only about that one child. क्योंकि जब हम स्पेक्ट्रम बोलते हैं तो ऐसा नहीं कि कोई बच्चा कम ऑटिस्टिक है और कोई बच्चा बहुत ज़्यादा ऑटिस्टिक है. इट बेसिकली मीन्स हर बच्चे में जो स्किल्स होते हैं वो अलग अलग कॉम्बिनेशन में होते हैं. क्योंकि जब हम पेरेंट्स को ऑटिज्म के बारे में बोलते हैं उनके माइंड में एक पर्टिकुलर स्टीरियोटाइप इमेज आता है, बट ऐसा नहीं है. उसमें भी काफ़ी डिफरेंसेस होते हैं. So they may have decreased interaction with peers, friends, demonstrates echolalia, which is repetition of words. Toe walking, sometimes you may see toe walking, you may see hand slapping. And the idea of therapy is not just to reduce the abnormal behavior. We have to understand when a child is on the spectrum, his communication is a challenge. So behavior is usually a way of communication. तो बहुत ज़रूरी है ये समझना कि वो behavior क्यों कर रहा है, and then to address that. And so it is not about stopping them from doing something, but understanding. क्योंकि इसके साथ साथ there is also sensory challenges that they may have, which include sound के लिए aversion होता है, touch के लिए aversion होता है, they like movement, they might be very on the go. So ये सब चीज़ों को evaluate करना बहुत ज़रूरी है. So as part of our developmental assessment, we look at all of these areas. Then the other thing which is seen is, and like Sir rightly said, now parents are also very aware. So they may come early. They may also Google and come. So sometimes they may have a sense that something is not right, but they also want to know from the specialist. And any child, so ADHD, while the name says attention deficit, it's more a challenge of regulation of attention. So he may not be able to focus attention at the right place at the right time. And hyperactivity or impulsivity. Also ADHD will look very different in boys and girls. In boys, जैसे हम ADHD बोलते हैं तो मन में वो आता है कि there is one child who is running and not listening. But in girls it can be very silent, which is mostly known as the inattentive type of ADHD. So in inattention it may look like, and typically these children, and also the other thing, this doesn't have anything to do with their intellectual level. Because this just says that these are the challenges they have, but that doesn't mean that intellectually they are challenged. That needs to be ascertained, through the development, through testing and from proper history. So in children with inattention would have difficulty with paying attention, making careless mistakes. कभी project work रहेगा तो submission will be very at the last minute, difficulty in organizing things, losing things very frequently, may not be given too many instructions at the same time, gets easily distracted, does not like to do work that requires mental effort, which means they may put away their school work for a very long time, so then they end up doing it very late. So these kind of things. Now, before diagnosing ADHD, it is important to ensure that it is there since childhood and it is present in at least 2 settings. Now, when we look at children, the 2 settings, one could be home, then it could be their social setting with friends, and in the school, which may look like not paying attention, daydreaming, always getting up, always wanting to use the washroom, and it is affecting their functioning. As in it is bringing a decline in their academic functioning. It is leading to peer troubles like constant fighting, not wanting to play, and it is there for at least 6 months. So this is inattention, and hyperactivity often fidgets, so may keep moving their hands and legs, wants to get up frequently, unable to take part in activities which are quieter, interrupts their parents or interrupts people while talking, cannot wait for their turn, which may be seen in children, and hence can be prone to more fights and often interrupts or intrudes others, blurts out an answer before the question has been completed. And it will also always feel like a बच्चे थोड़ा focus कर ले तो they can do so much better because they are very smart kids sometimes. So it is important to know that sometimes that extra hard work or extra focus is difficult. Now, why is it important to also know about this and diagnose it early? Because these children are often labeled as lazy, stubborn, defiant. थोड़ा और तुम कर लेते तो हो जाता, थोड़ा और practice कर लेते हो जाता. So in their childhood life, they hear so much of negative about them that it starts affecting their self-esteem also. So hence it is important to know about these things. And the other thing is learning disability. Learning disability is when there is a persistent difficulty in academic skills. Now this has nothing to do with intelligence. So primarily we look at whether their intelligence is within the normal level, whether their other sensory systems are fine, like their hearing, vision, motor, all that is ruled out. And then we see when the difficulties have started, is it in the early period? And it should be significantly below. At least 2 grade difference should be there between what the child is showing, meaning he could be at 8th grade and he could be demonstrating the writing or the teaching, the reading of a, let's say, 5th or 6th grade. So at least 2 grade equivalent का difference होता है when we look at learning disability. Now it is important because in the early ages, when we find out any challenges, then we can support them with remediation. When they come very late, because now children are not, kept back, they continue to, fare well, and 9th standard में पता चलता है he has difficulty in reading basic or doing math. And that time remediation के लिए तो time भी कम होता है, and then we rely on accommodations. So then we have to refer them to centers for testing, which is usually when it comes to a state board, you have to go to a government hospital like Sion or KEM to get the testing done. The testing that is done is basically an IQ and an educational assessment. So our remedial teacher, so these are some of the challenges. So when it is reading, it is called dyslexia. So dyslexia में there could be word recognition issue, sound recognition issue, very slow reading. They sometimes read the first word and they guess the whole word. And higher onwards, they may have difficulties in comprehension to understand what is said. So typically we say till grade 3 you learn to read, and then after that you read to learn. Meaning your basics should be set about reading, writing, math in the first primary years. After that you have to apply them. And for some children, if this has not been set, then आगे जाके they have difficulties. Then writing में the illegibility, capitalization, punctuation, grammatical, and higher skills like paragraph बराबर से लिखना, या वो ऐसे हम ऐसे लिखने देते हैं उनको, तो ऐसे में वो देख के you know the quantity or the quality, and you know what kind of essay it is, how many words he is able to write, what are the spelling errors. So, and then maths may sometimes they have issues with the sign, minus, plus, reversal of this letters as well as in numbers. Now in English may they have a challenge, or if they have reading issues, it also affects their math in the way, because a lot of math, when it comes to word problems, you have to understand the problem. So hence it is important to know what is affecting what. So these things can also overlap, and hence जब हम LD देखते हैं तो we have to also check for ADHD, क्योंकि अगर inattention है तो it will affect this, और अगर ये है it will look like he is not paying attention because there is no motivation. So for all this, it is important that we, so our remedial educator and psychologist is not here today, but the remedial educator basically works with children उनके जो difficulties हैं, dyslexia, language, writing, math related, तो उनके लिए वो they provide them from the basic reading writing skills and how to generalize it. And the psychologists, they do the testing and also provide the counseling. Now, where does counseling come? So, as the children grow older, there might be emotional challenges that they may have and behavioral issues. Now, for some of the conditions like ADHD, autism, there might be a higher chance of, especially ADHD, higher chance of addiction, higher chance of defiant behavior, risk-taking behavior, because and aggression, poor impulse control. So hence it is important to do a proper history and diagnosis. Then some of these things we spoke of: decline in academic performance, lack of motivation to study, difficulty concentrating. So all of these are very close and overlapping, and hence to be able to make sure this is that. So it is not, so sometimes we don't diagnose at the first sitting itself. We also, a lot of time we spend on counseling the parents to help them understand कि क्या चल रहा है, आप कैसे support कर सकते हो. क्योंकि जैसे from the development center we need a multidisciplinary support. At the home front also we need the parents to be very involved in the child's development. And then peer concerns, difficulty forming relationships, bullying. Children who might be having a neurodevelopment challenge may also be more prone for bullying. And then there is the excessive screen time, internet use, social media, and sleep challenges. So typically, what are the red flags that we overall look at is there is sudden and marked behavior change, persistent distress, persistent decline in school function at the home level, social isolation, severe aggression, or any sort of self-harm that might be there. So these are some of the challenges that might be there, and again, so this cannot be done by one person, so we need a multidisciplinary team, which is basically the developmental pediatrician who looks at a proper history and assessment, and then what are the therapies that we will be looking at, and the neurologist in case of any, there might be associated seizures or any other neural challenges, and psychiatrist for all the any other disorders that might be there, because they may be more prone for anxiety, depression, addiction, all of these. And then the others, our occupational therapists and speech therapists will share about their work. So yeah, so this is in short about what are the, most commonly seen things in an OPD and what parents might come to you with, and why it is important to refer, and why early intervention is important. The earlier we intervene and we're able to, and also a lot of time we have to spend with the family to talk to them, understand. There might be time, thoda denial hota hai, acceptance takes time. So it's also important to be empathetic, bring down their sense of guilt that they are actually holding, and work with them. Any questions? Okay. Thank you so much for listening.
Thank you, ma'am. Now this Masud brother, he will come and he'll speak on speech and language problems.
Good afternoon, everyone. This is Masud, audiologist and speech language pathologist. So today we are gathered here for our discussing topic, the developmental and behavioral problems of the child, and as well as their management. So, as a speech and language pathologist, I give the comprehensive guidelines, the assessment, diagnosis, treatment, as well as the counseling of the parents, how to treatment them. Because the clinician is responsible for the sessions, 45-minute session, 1 hour sessions, but बच्चे पूरा टाइम घर में ही रहते हैं पेरेंट्स के साथ. So along with the assessment diagnosis, we counsel the parents also what to do. So coming to the scope, by after referring, we get the child, we start assessing and diagnosis for the communication disorders. Then the intensive working with other medical professionals as well as evidence-based practices, whatever has research has been done, whatever theory has been come, and every child is different, and every child's language development, acquisition, everything is different. when the child has been come to us. Early intervention is a milestone in which period the language acquisition has been developed. So the SLP at the initially assessment should be done based on certain observations. So as we can look at here, after referring the child, we take the case history from the parents, we check the hearing status of the child has normal hearing, or we suggest certain tests, behavioral as well as the diagnostic test. Just like the OE, that their inner ear has any problem, inner ear is responding or not. Uh, and also main thing that for the speech and language development is the oromotor examination. We check different articulators, they are properly working or not. We check the lips, tongue, jaw, palate, and how the dentition is coming. Because you can all see my mouth, how is it movement. The lips, my tongue, my cheeks, everything is coordinated. If the child does not open his mouth, how he or she will start talking? Okay, so and the mode of communication should be there. कुछ parents बोलते हैं मेरे बच्चे तो बात ही नहीं करते हैं, but after age 1.5 year 2 years child started mode of communication will be there. There should be non-verbal mode of communication, there should be verbal mode of communication. कोई बच्चा अगर बात नहीं कर रहे but certain points such as pointing towards the object or dragging the hands of the parents towards the object or crying, vocalization, everything is a mode of response, how the child shows for his expressing demands and wants. For the verbal mode of communication, there is certain, some child start vocalization, some shows the one of utterance, some shows two word utterance. So coming to the point, there are several developmental stages there from birth to the 6 years of age. The next thing is the receptive and expressive language development, which is majorly impactful thing and may key challenge for the speech therapist. Without developing the reception, that is, reception is nothing but the understanding of any lexical items. By the expression will come after development of the reception. If the child does not know this is apple, apple is red in color, apple is sweet in taste, he cannot give to parent, chalo beta ek apple de do mujhe, he can't give. Okay, so first is the developing the reception. Another thing, major impact is the pragmatics part, that is the eye contact, attention, social greetings. The joint attention is an important factor, be it with the clinician, be it with the parents, be it with the caregivers. Okay. Then turn taking and social communication is also important, for as we can see in autism spectrum disorder, social deficit, social communication deficiency will be there. They will be in their own world, does not respond to name, they show lack of attention, lack of poor response to name calling, lack of sitting tolerance also is there. And also the SLP assess the voice, feeding and swallowing difficulties are there. In the developmental period, another thing is the cerebral palsy. In cerebral palsy child, we normally, it has been research based, also we can evidence based. There is oromotor weakness should be there. It's available in the for expressing his needs, wants, thoughts with their family members, we use that also. If the language acquisition period it is over, certain tools and techniques has been proposed. There several standardized tests we can see, just like read for the verbal child, GSSH for the non-verbal child. For the misarticulation is also there. Misarticulation, whenever child is saying the words, the initial, medial, and final positions of the words will be clarified. So just like there are errors like substitution. Suppose if the child says baba for mama, so he substituted the ma for ba. Child does not know both are bilateral sound, ba, pa, ma. Everything coming by touch with our lips. So the speech language pathologist showing how to place of articulation in every consonant, how the weaknesses should be achieved. So at least the child, if non-verbal weaknesses should be achieved. So at least the child, if non-verbal, early intervention is the major important key factor for language development. If the our target is if the child starts certain vocalization at the age of 2 years, immediately starting the speech therapy is very much essential. So we all speech clarity, initial, medial, final, the intelligibility. When if the front person is they can interpret whatever he or she is saying. And the language disorder is a vast topic. In language disorder, there is we can see the developmental milestone is there. In several syndromes are there, such as Down syndrome, Fragile X syndrome, as well as the ASD, ADHD is there. Delayed speech and language development. बच्चा तो बात तो करता है, but कुछ कुछ एक दो बोलता है. That is also the language delay. बच्चा पूरा sentence में express नहीं करता है. There after stroke and as well as the and autism, they will be in their own world. So certain therapeutic techniques, childhood oriented approach, attracting to their brain oriented approach, attracting to their brain. The speech therapy is always